If you combine heart disease and stroke together, it takes out about 900,000 Americans every single year. You remember during the pandemic when you see this, breaking headline news from COVID, right? 500, 600, right? But no one is seeing this headline of heart disease, right? Which I would lump in stroke and, for men, erectile dysfunction. So essentially the same disease, right? Which I like to call grid-like traffic on the 405, essentially. No one is, having these headlines everywhere, right? And no one's questioning, where does this come from? Where's the root cause, right? In our healthcare system, we spent 2023 $4.9 trillion with a T, okay? $4.9 trillion in healthcare expenditures, okay? Which is basically exceeding the entire economy of Japan, okay? 90% of that expenditure is mostly on chronic disease management and mental health conditions. That's what, that money is spending. But we are not really getting anywhere. In fact, Financial Times, clocks us at the lowest in terms of health outcomes and life expectancy, around like 77 years. Okay, this is 2022 stats. Japan, let's use Japan again. Their life expectancy is mid, 84, 85. They spend 60% less per capita, okay, in their healthcare expenditures.
Very interesting.
So, in terms of advances, technologies, right, we're able to fast track a vaccine really quickly. It's great, but it's not unfortunately, the panacea of what we call our chronic disease burden, which includes obesity. I would also lump, loneliness as well, because we have a loneliness epidemic as well.
I was going to say, when you said top 10 killers, we do this slide for our team when I go through the mission stuff. I have I call the light side and the dark side. The dark side of my industry, our industry, health industry, whatever, is that these are the top 10 killers in America today. The light side of it is that most of them are preventable. Most of them are preventable from good diet and lifestyle. In that mix, suicides in there is one of the top killers also, right? So you've got like heart disease, diabetes, stroke, cancer. Like there's a lot of those causes, and suicide's up there towards the top of those too. But when you think about suicide, like why would people decide to end their life? A lot of the times, probably because they're in pain, right? I think a lot of the time pain management is overlooked, or they can't get the treatment that they're seeing, or it's chronic and they don't see a way out. And so loneliness, pain, again, I think these are preventable issues that we need to do something about, and it starts with probably what we're putting in our mouth for the most part.
Yeah, for sure. Loneliness by itself in 2023, this U.S. Surgeon General just basically called it as it will, right? He saw it 10 years before he became Surgeon General, and 50% of Americans report many different symptoms of loneliness. And chronic loneliness is linked towards heart disease, stroke, even dementia. So that's why it's a pillar for us, stress management and also social connections. There's a longest study of adult development, Harvard study, 75, 80 years plus, multiple generations, found that relationships, good quality, positive relationships, is the number one positive predictor of your health and your longevity, essentially. It even trumps diet and physical activity, If you look at the blue zones, which are the longest living concentrations of people on planet Earth, social connections is right up there, right? So yes, we are going to talk about food, but lifestyle medicine really is talking about all the pillars and not forgetting all of them and optimizing each one of them as much as possible.
Man, love it. Absolutely. That's powerful. I mean, we out here trying to affect people too. That's Fitness on Fire. The whole concept. Everybody loves everybody, right? Trying to create a community, because I think we're better in tribes. I just think we're better in tribes, better in communities, better with friends, right? So I really, I haven't heard some of those stats before, but that reaffirms my life's mission of what I've been working on here, which is trying to create a social hub where people can be themselves and show up and show empathy and just love for their fellow humans. So.
Yeah.
Love it, man.
Yeah. We're definitely, I mean, different topic, but we're definitely in a very, he versus, she, red, blue, it's just a lot of tug of war type of, energy. And it's like, man, why? We're all on the same planet. We're trying to do our thing, trying to live, survive. I know some of us are surviving, but hopefully we can, we can thrive together. What I love about when I start teaching is using the examples and the words of, because I think words are powerful. You mentioned public speaking off camera. And what I learned early on is the power of words. And so if you take up the word illness and you put it next to the word wellness, right? What do they have similar and what do they have dissimilar? Illness has the word I, and wellness has the word we. So a lot of times when we're going through a certain type of sickness, we're doing it alone, right? We mentioned loneliness, but wellness, there's the word we in it. So it's really predicated on not just, nourishing your bodies, but nourishing the people around you and having that interconnectedness and support, that social construct. We're meant to be social beings. We're meant to, exude love and compassion to one another. And somewhere along the way through different layers and aspects of society, we're just taught the opposite for whatever reason, right? So,
man, super powerful, super powerful. So I asked you a loaded question to start with, like, how do we prevent this stuff? And you actually did a really good job answering specifically with the 6 pillars, right? So 6 pillars, I learned a lot there. I think that I would love to hear your take on nutrition specifically. So as we talk about nutrition and food being a part of one of those first pillars, tell me a little bit about what are some of the common things that you're teaching people to help them prevent illness regarding nutrition and food?
So this is what I'll say from a science point of view and also say it from a clinical point of view. So whenever I have a patient, right, I'll set up the scene. Whenever I have a patient, they come in for all kinds of stuff. High blood pressure, diabetes, cancer, my family history. My dad had colon cancer. I'm trying to get off of smoking. And a lot of times it's traditional. Let's band-aid it by giving you a medication. And if something is really, really bad, let's cut you open, right? And even though our modern medicine is good, right, and our surgical, procedures are amazing, right? We even have like robots performing surgeries nowadays. But even though all that is great, it's still coming back to my point. It doesn't go to the root cause. And so being raised by the mother that I, mentioned before, it's always about, where does it come from? You have to ask the why, right? How does disease form? When you're in school, when I was in school at the time, medical school training was mostly 2 big things, okay? How does disease manifest, which is called pathophysiology, and how does drugs work, which is pharmacology. Very, very, very little in terms of nutrition, very little in terms of lifestyle, self-care, things like that. In fact, my only form of nutrition was only 10 credit hours, and that was in the form of biochemistry, right? Very interesting. And that was across the board, most doctors, right? And training to be a doctor, that was, less so. So when I was in school, I followed a lot of my predecessors, brilliant clinicians, super smart. But no matter who came through our door, their reason for visit was, hey, I got a cough, or hey, I got a low back pain. Every one of these patients that walked through had some sort of chronic lifestyle risk factor, high blood pressure, diabetes, carried some extra weight. And I said to myself at the time, I was like, I'm just very ill prepared. Like, I'm just not prepared for this. And so I took a very atypical pathway after school. I had a gap year after medical school, and I enrolled myself. I wanted to learn something beyond nutrition. I wanted to understand, our food system, where it comes from, and what are all the behind the scenes factors that play in before something arrives to your plate.
Okay.
I needed to understand that. So I enrolled myself into culinary school in Manhattan. I'm originally from New Jersey. And then I also got certified in health coaching as well, because public speaking, very important in terms of how you communicate with, another person. So I did all that, and I started focusing, more on food as medicine. And so when you dive deep into the research, we find that a lot of things can be not just preventable, but in some cases can be reversible. In fact, in the early 1990s, we actually knew from early 1990s that heart disease, our number one killer, can actually be reversed on a proper lifestyle, regimen, okay, which is not smoking, physical activity, social support, okay. There's a study called the Lifestyle Heart Trial by Dean Ornish. And that was back in 1990. And the diet, he implemented a low-fat, whole-food, plant-based diet. He did all that, did a study with that, and he was able to prove that heart disease was able to reverse. He did a follow-up trial 8 years later, and then he proved the same patients actually got better. Actually improved. Another cardiothoracic surgeon, okay, he was able to document the same thing. He would use actual imaging to be able to show that arteries actually open back up, through basically food intervention, nutritional intervention. So all that to say is that there's a lot, all right? So to answer your question is, why are people sick? Well, if we're, I hate to generalize, but let's just say your, standard American diet, okay? What makes up the standard American diet? What we find is that it's mostly animal-based foods, and then also ultra-processed foods, right? Like sugars, oils, processed oils, candy, cereal, flours, things like that, and foods in various different types of preparation. A large part of that we find is kind of like the backbone of what's creating this chronic disease. Why? Because you're seeing different levels of chronic inflammation. You're seeing different levels of kind of like a sped up oxidative like process,
Sure.
Kind of like rust to a car. And what you're also seeing is dysbiosis, an imbalance of your microbiome, right? Which we're hearing more and more about, which is our gut health, and lack of fiber. We have to focus on protein, but I would also say another essential nutrient that we're lacking and actually deficient on is actually fiber. In fact, 95 to 97% of Americans are actually deficient in fiber. And fiber only exists in plant foods. There's actually no fiber in animal-based foods. And what is fiber? Fiber is kind of like, there's two forms. You have soluble and insoluble forms of fiber. And, fiber is way more than just having a good poop. What it does is that, once it goes into your, gut microbiome, it helps to regulate your cholesterol. It helps to regulate your weight. It reduces your risk of heart disease. And we're finding more and more, positive effects. Because your microbiome is Manhattan, right? Manhattan is what? 8 million people, right? Multiply that by 5 million times Manhattan. And that is the makeup of your microbiome. So you don't live by yourself. Well, you have your kids and your wife, right? But you actually live with 40 trillion other microorganisms in your gut right now. And I would like to say there's a seesaw effect. So when you're putting certain foods, it tips the scale of a certain ratio for your microbiome to be healthy. And when it's healthier, it produces something called short-chain fatty acids, which helps to regulate all those different, things that I mentioned. But if you feed it unhealthy food, what it does is that it pushes the seesaw the opposite direction, and they produce negative effects, which leads to a whole host of other conditions as well. So a lot of different components.
Yeah, and I'm sure it depends on the person and the condition and all these things, but I think you hit on a couple of things. So I just want to reiterate to make sure I picked it up and make sure our audience picked it up. But you talked about maybe it's not protein as a deficiency, but it's fiber as a deficiency. And I think that's such a powerful concept in general, right? I think when you look at the SAD diet, right, the standard American diet, and you're looking at fast foods, ultra processed foods, it's not just sugars, by the way. When you look at sugar and you see sugar in your nutrition facts, that is like one of like a billion ways that they hide sugars. Sugars show up in all types of form, whether it's these syrups, these these corn syrups. Sugar is everywhere around us right now, and it's ultra processed refined sugars. It's awful. All of this being said, when you're eating these ultra processed foods, you're eating these ultra processed excess sugars, and then you're not getting any plant-based nutrition in your diet, you are setting yourself up for disease.
Yeah.
And for most, I grew up, I didn't really eat a lot of vegetables as a young man. As a young boy or a young man, I can't tell you I love vegetables growing up, right? I do now, but I try to find, I still have to find cheat codes to get them into my nutrition, right? Whether it's blending them, making smoothies or juices, and I know juices are probably cutting some of the fiber out of there. So we'll say smoothies before you get me.
It's better than nothing.
But I think it is a challenge. I think it's a challenge for people to get in some of their plant-based nutrition and their vegetables. So where does somebody start if they're like, gosh, I'm on the standard American diet right now, and I'm hearing what you guys are saying right now, but I don't really know how to make the bridge to vegetables or other things. Where does somebody start?
Yeah, so basically, the USDA guidelines for nutrition, okay, we're currently in 2020 to 2025 guidelines. What's going to come up is the next 5 years, 2025 to 2030. And we recommend at least, and I would say this is probably not even enough, 5 to 7 servings of, vegetables and fruits. 10% of Americans actually get that. 10%,
Believe that.
right? 330 to 350 Americans, 10% of that actually get that, right? 97% are deficient in fiber. And so it's not as simple as, we need to understand why that is, right? And so, for example, our tax dollars become government subsidies for specialized programs, okay? This is what we call the Farm Bill, right? And what the Farm Bill is this gigantic, piece of legislation. It created nutritional programs, the SNAP program, the WIC program, but it also creates a lot of dollars to help out the agricultural industry, as well, right? And so what I've just learned, because I also have a podcast, is I had a Farm Bill expert come on my show. And this blew me away, is that, believe it or not, 2/3 of our vegetables and fruits are actually imported into the United States, okay? And the average age of a farmer is actually nearing 60s. So what that means is that a lot of the farms are being monopolized by agricultural corporations, right? So what that means is that they have dictating power in terms of what they're going to produce. And our government subsidies, our taxpayer monies, is going towards mainly just a few crops, okay? Which is mainly corn, wheat, soybeans, right? And a lot of that is not actually going towards human consumption. A lot of that is actually going towards animal agricultural, livestock, feeding them. Why? Because you're trying to fatten up the livestock, the cow, the chicken, the pig, right? Why? Because it sells more, okay? And so if you think about it, that's not actually the natural form of food that we're actually, eating. Most animals in this country are what we call CAFOs, concentrated animal feeding operations, which is kind of basically in the middle of America. What that means is that because the demand for meat is so high, the industry has to meet that demand. It has to address that demand. So in order to do that, they have to set up these CAFOs in order to meet that demand. So they would have to feed them this type of feed, corn, soybeans, to fatten them up, to go to that kind of productive rate to be able to feed the demand. But it's not the natural form of what they're supposed to eat. Nutritionally speaking, if you just ate, animals, you're actually getting more inflammatory components because they're not even being fed that well, right? And then a whole nother issue is that it has ripple effects. It's not sustainable. It takes up a lot of land resources. So, we just, at the time of this recording, we just finished the Super Bowl, right? So I'll give you a football analogy. If someone was on the, standard American diet, heavily eating more just animals, right? In order to sustain one person on an animal-based, diet, you would need the equivalent size of 3 football fields, to sustain one person. I'm going to use a water, fact. Do you know how many gallons of water it takes to produce 1 pound of beef?
I do not.
It takes approximately 1,800 gallons
Oh, wow. Okay.
of water to produce 1 pound, whereas like lentils, a pound of lentils would take 43. So to put that in perspective, whenever you're at home, you hear the faucet turn on, right? You hear it, you're like, oh, it's on. I'm going to turn it off. Imagine that faucet turning on and running for 15 hours straight. That is the equivalent of how much water usage you would need to produce 1 pound of beef.
Crazy.
Yeah. So that's the point of my work, is really to help people connect these dots. And, I'm not trying to say, I'm more this and more that. It's more that if you understand the interconnecting dots and understand, okay, what is going to benefit, individually, but also, what kind of effects it's going to have on your community and globally as well, right?
It's interesting because it goes twofold. Like when I was a little boy, my dad told me two things. He said, or one thing that really like has changed my trajectory in all my life. If I only like learned one thing, I'm sure I learned a lot of things, but this is one thing that's always stuck with me: is there's two types of things in life. There's things you can, there's things you cannot control, right? So I've spent most of my life trying to figure out what I can control and focus most of my efforts there, where trying to stay a little bit away from things that I cannot control because it's overwhelming and blah blah blah. But this creates a double-edged sword, because when you don't think you have any control or any say or a vote or any impact in something, and you're not doing anything about it, then maybe it gets further out of your control. So it's like this weird double-edged sword. My question here goes to, first off, I think it starts with awareness, right? Like people have to know how all this stuff works and what's going on. So I think your work is invaluable, and what you're talking about, the information you're sharing, the statistics you're sharing, I think it's wildly valuable. I think for some people, they're going to sit on one of these two sides of the coin. They're going to sit on one side that's like, well, that's all well and good, but how's that affect me? Or how do I do something with that? Then a part of it's like, well, if you don't start doing something about that, then it's going to become even a bigger issue, right? So you can't ignore and turn a blind eye to it just because you don't actually push the button yourself. However, I think part of it's awareness. The other question is where does somebody that's just trying to get off of this hamster wheel of poor nutrition and low fiber diet and overly inflammation heavy food, like where does somebody where do they start? Like what's the first thing that a layman does to just start taking some action to start moving more towards a healthy lifestyle that's going to maybe be more sustainable for our entire
that is a very, very good question, because we live in, you're talking about over information, right? Usually for me, I try to fit in a lifestyle medicine oriented talk. And what that means is that, we go over your family history, mom, dad, grandma, grandpa, uncle, aunt, right? Who had chronic disease, who had high blood pressure, who had disease, who had cancer in the family, right? We talk about that. Then on the screen, on the computer, I pull up your lab results, your biomarkers, right? Your diabetic score, your cholesterol, right? Your blood pressure, right? I measure people's waist circumference, I think, abdominal, visceral fat, very, very important, right? Not typically done in a healthcare office, but I do it. And so, I have those stats up, and I have the patient in front of me. So within 15 minutes, I, teach them how chronic disease work, right? I, go over where they came from, because, they told me their family history, and then their labs, which are in front of me, and where they're going. And I tell them, you have one of two pathways. You either make the choices, right? This includes eating, in terms of feeding health, or you're feeding disease. That's really one of two pathways, essentially. And so, and it's really that point blank, this is where you came from. Do you want to continue where you came from? And this is where you're going, right? And most of the time, the biomarkers are high cholesterol, they're pre-diabetic, they're overweight, right? High BMI, et cetera. They usually have a, pretty large, waist circumference. And so I set them up this. And so it's pretty much obvious, after I give them that spiel, which took me years to kind of just hone within 15 minutes. And then, I do this for every one of my patients, even if they came for a different reason, because if I have a chance to be able to prevent something in the future for them, why not?
Sure.
Right? Because a lot of times, yes, money is very important. Economics right nowadays, especially nowadays, people are, skimming by. I get it, right? But what I tell people is that you could either invest in your health now or spend time for illness later on. You know what I'm saying? So the cost is going to be even greater when you show up in the hospital. It's going to be even greater in an ER room or an ICU, right? And you know that, healthcare insurance covers what? Nothing.
For sure.
But I would say being a family practitioner and, working on the work that I have to cater to everyone, the full spectrum of people, right? And my job is really to meet people where they're at. Kind of like, you being a trainer, you have to meet people where they're at in terms of where they are and where they want to go. Same thing. And so I meet them where they're at and, it really just comes down to behavior change. Same thing with fitness, right? How can I nudge someone on a spectrum toward a North Star? And, I would tell them that, I just want you to do your best, 1% better than yesterday, right? And so, 1% is very powerful. It has a compounding effect. If you just do 1%, like if you and I were just standing together and I just shifted you 1% in a different direction, and we just said, okay, let's walk in a straight line. It may not seem like it at first, but after a few, hundreds of steps, you and I are going to be in a different spot, right? And so it's very powerful. I wouldn't say don't underestimate, what you can do. Do what you can. Do what you can within your limits. That question is going to be different from someone that is living in a poor, lower socioeconomic status. Versus someone that's in, middle class, upper class, right? Because even if you look at the map of America, there's maps like this, the high quality supermarket are actually designated strategically, okay, in wealthier
in areas that people can afford it.
Yeah.
Where you have these food deserts in these other areas of the world where you can't find a vegetable
food access
to save your life, right?
Food access. So that's, it's part of the infrastructure. So I would probably say, unfortunately, we're not really set up for success, in America, right? And, I mentioned blue zones, right? Blue zones, like I said, are, different pockets of the planet that have outlived, 100 plus years in large concentrations. But it's not just the food. They had communities, they had walking paths, they were able to move their bodies all the time. They actually did not go to the gym, right? If we're talking about physical activity, they did something called low impact physical activity. So what does that mean? That meant gardening, that meant riding their bike, that meant, walking, right? They didn't do, which all has its own, stuff. But there was a lot, they were set up for success. Europe, they have, plazas, they have, squares, center squares, right, that people congregate to, right? I studied abroad in Spain when I was in college, right? During the summertime, the sun didn't set until like 9:30 at night.
Oh, nice.
And at around midnight is when, the grandparents would bring out their grandkids and the kids would, come with a soccer ball at midnight. And that's their social hour. So my point is that, in America, depending on where you are, you either have to be part of the community, right? Find your community or create your community. And so it's really about having that central hub of not just knowledge, but implementation of that knowledge in order to further not just your health, but wellness, overall.
Yeah, absolutely love it. Gosh, a lot to think about there. My mind's working now. Mine's working for sure. So it's that's powerful. Do you have any maybe like some success stories of maybe some things that you've seen? Maybe personal anecdotes or clients that have maybe come to you with certain conditions that have been maybe reversed, helped, healed through nutrition or through your 6 pillars?
Yeah, for sure. I had one patient, he was a traveling salesman. He is a Filipino American and he's a male and he was overweight, had some cholesterol biomarkers that were up. And basically I give him the same exact spiel, right? Plant-based nutrition, yada, yada, yada. And basically in 2 months, he lost 30 pounds and had more energy. He just felt great. I had another patient lost 21 pounds, 3 months, same exact thing, right? And then another patient, 10 pounds and dropped her blood pressure, dropped, cholesterol scores. So that was just based on, plant-based nutrition. So, but I didn't anticipate them to be like that motivated. So it really is about meeting people where they're at. And it's really based on, their stage of readiness, right? Their stage of change, right? Where they fall. And for me to save time for myself, I know when someone's ready or not, to change. And if they're not ready to change, then I don't go as deep. And that saves me, right? And then when they're ready, so you can't, lead a horse to, water. You can't force them to drink.
Yeah, for sure.
Yeah.
I talk to the coaches about this a lot too, because it's not every person that comes into the gym that says they want results is going to get the results. Even if you teach them the same things, you run them through the same programs, all that kind of stuff, I think there is something about personal accountability for when you're ready to change your life and you're ready to get that fire inside your belly to get you to do the thing. But what is a damn shame is for some reason humans, it's like we don't do it until we have to a lot of the times, right? So it's like, dude, if I ate a hamburger today and I drop dead of a heart attack instantaneously, people stop eating hamburgers. But it doesn't work like that, right? It's like
that happens all the time.
That's fair, right? But it's
900,000 times,
right? But from a compounding aspect, right? Yeah. It's not the first hamburger you ate; it's the 100,000th hamburger you ate. It's the lifestyle of accumulating compound interest of you feeding that disease that eventually becomes something that you can't reverse.
Yeah.
And then on the other end of it, it's like, well, if I ate vegetables and I lost weight immediately, or if I ate vegetables and I felt better, or I got 6-pack abs immediately, then people would eat more vegetables, right? But it doesn't work like that. Every time you open your mouth and you put food in your mouth, I like what you said, you're either feeding your health or you're feeding disease. And it shows up, unfortunately, in compounding efforts, right? So what you're doing today may not show up right now, but that 1% accumulates and it compounds and eventually it will equal disease or health, right? So it's just a damn shame that we don't, when I'm working with a lot of the people I've worked with in my lifetime, people come in sick and unhealthy, and sometimes they're not ready for a change until they're almost like threatened to make a change. It's like they go to their doctor's like, look, man, you've got X amount of months to live. You've got this chronic disease. You've got this life-threatening illness now. You got to do something about it. And it finally becomes a call to action for that person to make the change. Why can't we make the change before it becomes that, right?
I think a lot of it is because our society is currently, built on immediate gratification. And so that applies to health, right? They want the Ozempic, right? They want, the Botox. They want, all these. They want the immediate gratification. And so what's hard about our work is that it's a slow burn. It's the, good food takes time, right? A good relationship, marriage takes time, right? Planting something, right? A flower bed, a garden takes time. And so, I would say to, a patient in front of me, I'm like, they're obese, they have high blood pressure, their diabetic score numbers are off the chart. I'm like, you didn't get here overnight. You know what I'm saying? You got here over time, right? So in order to get to your healthier version of yourself is also going to, take time. This is not a sprint. This is a marathon. And so what I'm teaching you is skill sets, which you have to implement over time. And so one of the things I do differently is I invite my patients to come back every 6 weeks. So being, also a health coach as well, we've learned, the power of frequency. You mentioned accountability, right? And that reinforcement. So the more times you show up and see me, the more I'm going to coach you and be like, hey, how's, you made that switch, how's that going, right? So it gets them, accountable, because we're always going to have those off days and down days in terms of like, oh, I think I failed or whatever. No, it's like, there's no failures. There's just learning lessons, right? And so unless you didn't learn anything, then it's, then it's a failure, right? So, but yeah, it's that frequency, it's that accountability, and it's that time and patience. I think we don't have enough patience for ourselves because the outside environment is set up for us just for immediate
we're looking for that
gratification.
quick fix, it seems like. I definitely agree. I think that's really well said, man. Dr. Colin, man, thank you again. I don't know if the Fitness on Fire community knows how much of a resource you really are for them. So real quick, would you tell us maybe where they can connect with you? And then if you had an offer for our listeners today, I'd love to hear kind of what you're working on.
Yeah. So part of what I do, thank you so much for having me, by the way. So part of what I do is, I'm a physician out in the community, but I also do lifestyle medicine consulting and coaching as well. But I also have created a lot of content over the years. And so what I would like to offer to you in the community is the 6 pillars, right? I think it's always good to have a refresher on what that really means, right? It could be very simple as like, oh, move more, eat less and like sleep more. It's not as simple, And I think that once you understand the context of the why is it so powerful to make these fundamental changes, for our lives, then I think it's easier to stick because we talked about behavior change. So I would love to offer kind of like a mini course in terms of the 6 pillars for your audience members, and you can just punch in the code like 6 pillars, and that'll get you in through the back end of my website, which is www.thechefdoc.app. And then on my social media handles, it's at the Chef Doc on all platforms.
Love it. And we'll make sure to include all that in the show notes and all that kind of stuff too, so people can connect with you there. And we will definitely collaborate more, man. We'll talk more. We'll get in front of the Fitness on Fire community a little bit. I'd love to possibly get on your podcast one of these days. And you are an incredible resource, brother. This was a lot of good information today. So thank you so much for that.
Hey, man, it's been an honor. Appreciate it, man.
Absolutely, brother. Thank you.